Ladies and gentlemen, welcome. On this series of What's Up Doc, we cover some of the most interesting doctors and we get to interact with them, have a one on one with them. Today, joining us on What's Up Doc is one of the most well known oncologists. He is a robotic surgeon, he is also a laparoscopic surgeon. Oodles of experience in the kitty, and it's our honor, pleasure to have Dr. Sandeep Nayak. Thank you so very much.
Thank you, Sriram.
Talk to me about how the medical field has changed over the years. You've been part of it for so many years, and how the field has actually evolved over the years, Doctor.
See, medicine is an evolving field. It always keeps evolving. It is never, a doctor who doesn't evolve with medicine is static and he's not going to do, good in what he's doing because changes are constant. There has been time when, if I take, say, for example, one specific example of, cancer surgery for that matter. So there was a time when cancer surgery had to happen by open method. Means people had to be opened up with large wounds. They were considered very large surgeries, and there was a lot of pain involved, and recovery time was longer. But what happened is a lot of things changed off late. Like for the past about 15-20 years, things started evolving. Like we first was the laparoscopy when the late part of the last century. Laparoscopic surgery became more common. Initially, it was a few small surgeries which were performed, but then the things changed and people or the vision systems evolved, and we had things like energy sources, what we call, where quality of surgery could be improved, and that made a lot of change. In fact, so people could perform bigger surgeries with laparoscopy. Laparoscopy means you're using very small wounds to do big surgeries.
Yeah.
So when we and over time that became so common, and people started venturing into doing bigger surgeries and bigger surgeries with laparoscopy. So that change really brought about what we are today, and that is the robotic surgery and all that. Because see, what happens in medicine is we look at the problem. See, you see a problem, you want to solve that problem. So, and that is what happened to medicine. So, we saw that, there was some defects with laparoscopy. We had to correct that defect. So, slowly, scientists and the people who are working on it started thinking about it, and the robotics came.
Right.
So, robotics basically solves some of the defects which are there with laparoscopy. So, and see, this is how medicine evolves.
And today, of course, as known as minimal invasive surgery, it's as minimal as it can get. Let's talk about cancer per se, doctor. We are in the midst of a pandemic, but cancer has always been a killer of sorts. The statistics are mind-boggling.
Yes.
In every 5 minutes, a person is affected with some sort of cancer or not. What do you have to say about the overall impact that cancer has had on a country like India?
See, when we take the statistics of diseases that we all suffer from, cancer is slowly emerging to be one of the most common diseases. Because there was a time, say about 50 years back or 60 years back, we used to see a lot of other diseases like infectious diseases like TB, or people used to die of typhoid. So that was quite common. So many other diseases. So what has happened over the years is that incidence or the problems caused by infectious diseases has come down significantly. I don't know whether you know the statistics. In 1900, that is year 1900, average life expectancy of Indians was 37 years.
Right. Yeah. I've heard about this.
Yeah. So today we are nearing 80. So why that happened is because we were able to get control of infections. Primarily because we were able to get control over infections. Second thing that happened in the same period was we could treat the chronic diseases better, like BP or hypertension, what we call, or diabetes. All these things we could treat better. Now, as the people survive longer, as they have conquered infections, chronic diseases, there will be other diseases which are less common or we were less common, which becomes more prominent.
Right.
Very fact that human beings are not permanent on earth.
Yeah.
We have to get some diseases. Diseases are always there. They are going to be there. So that is why we see a constant rise in the incidence of diseases or cancer, cardiovascular diseases. These diseases are becoming common now. So it is not that the new disease came. The existing disease became more common because people are living longer.
Right.
That's all has happened. So in India also today, if you look at the most recent data, the 2020 data, what we are looking at, cancer has become the most common cause of death. So we are already there. It's not that cancer has increased. Remember what I have said. So when it is compared to other diseases, as they went down, cancer came up. Now you also talked about pandemic. Actually, it will be very interesting again for you to know that the cause of death in US. If you look at they had a peak in somewhere in June of this pandemic, the COVID disease death. Now, if you look at their graph, number of deaths caused due to COVID and compare it to the number of deaths caused due to cancer is still more.
Wow.
That means we were handling a disease which was deadlier than COVID all the while. Now, why did the international world react this way to the pandemic, or the government reacted? Is it wrong? Again, because that's something which will again raise when you are asking this or when I say this. It is not wrong. In fact, lockdown and all the measures that they took was required. It is merely because the number of people, if you are not locked down, number of people who would have needed healthcare facility to take care of themselves was so large that we wouldn't have been able to handle it. The world wouldn't have been able to handle it. We would have reached something like the Italian status in the beginning.
Completely
entire world, entire world's healthcare system would have been overwhelmed if it had not been locked down.
Right.
So to avoid that, whatever we did was to avoid it. But at individual level, if you look at COVID, at individual level, your risk is not very high. We have a higher risk of dying because of other causes, other diseases.
That is ironic at the same time.
Yes.
What a situation to be in.
Yeah.
We'll talk a little bit about lifestyle as well and how much it actually matters and affects a cancer patient as such, or to even get there. Doctor, you are a robotic surgeon as well, and to a common layperson like me, I've heard that it's almost like fine art. Talk to me about what actually happens and what is the procedure.
See, surgery itself is fine art. Okay, it is never. Anything to do with work of hand is fine art.
Yeah.
So finally, and I took surgery because of that reason. Because lot of I am interested in art. I have done a lot of. I used to do paintings. After late, I don't have time. I used to do a lot of pencil sketch. I don't have time now. But I do surgery. So that is the art, and that is the performance art which I do now.
Mm-hmm.
So when it comes to the surgeries like robotic or laparoscopic, it takes it to the next level. Though there are some advantages of using robotics and laparoscopy, but there is all new learning that has to happen from the end of the surgeon. So it is something like you are, instead of using this recording camera, you are using something new which has much more facilities, but you need to relearn what you are using.
True.
So that is the thing which is involved. So in fact, if you didn't know, I'll tell you something very interesting. In fact, robotic surgery was invented for heart,
Okay. Okay.
heart surgeries.
Mhm.
But it ended up being used for prostate.
Right.
Prostate is the male, this thing, prostate is in males. So, prostate surgery is the most common surgery which is performed with robotics.
With robotic surgery.
So, they missed the heart and hit the prostate actually.
Right.
So, that is what happened. And in fact, very few, heart surgeons use, robot today.
Okay.
Very few in the world. In fact, it is hardly used. They don't find much utility for it.
Right.
But for us, as for cancer, as we perform very, very complex surgeries most of the times, so for us, for some areas in the body, like, very deep areas, like, what we call as rectum and all these areas, prostate, rectum, some of the things are my own inventions, like the robotic neck dissection or rabbit for thyroid surgery. These things, it's very useful. It is very, very effective. And the idea is, advantage of a robo is that in a very, very narrow area, narrow space, very limited space, we can do very intricate work. That is the advantage, because even the instruments are about 7 millimeters in size, and they have wrist-like movement. And basically, the surgeon sits on a console, moves his hand as naturally as possible, looking at the 3D immersive video basically,
Right.
and the surgery happens like that. So the surgeon has a feel of sitting inside that space, that environment, or the operative field and operating.
Mm-hmm.
So literally, I am in the field when I am operating that.
My God.
So-
it is so fascinating,
Yeah.
and at the same time, in today's world, wearing the PPE kit and doing all of this could be all the more stressful, but you guys are pulling it off, so kudos. Well done. on
We
that.
don't use PPE kits.
Not
No,
at all.
we don't use, because see, PPE kits are not practical. We use level 1 PPE. What is the mask and the basic level of PPE. Today we use the N95 mask. That's by far. Again, it's my opinion again, and many of I think doctors will share this with you, because see, COVID is a respiratory virus. It is not a virus of cholera. It's a bacteria, cholera by the way, but
Yeah.
or what we call rotavirus, or something which you can drink and get a disease. Okay, so or touch something and get it. So this virus is something which you will inhale. Means you need to, your respiratory tract is the most thing. So if you cover this much, you have covered most of it.
Right.
The other 10% risk, I think we have to take, because there is no way I can operate with a PPE.
Right.
I am doing a 6-hour surgery. N95 is a hindrance for me.
Right.
So, it's not
A
practical.
PPE suit is out of question.
It's out of question.
Altogether.
Half an hour, 45 minute surgeries, it's possible. But none of my works are like that.
Okay. Wow.
We are all 3 hours is minimum. Less than that is, we don't have any surgeries less than that.
This is really fascinating, Doctor, and thank you once again for taking us through these bits. Let's come over to something that's developed recently, or of course, it's an ongoing debate that's been heavily discussed. The Indian Medical Association recently called for a strike, and this had a lot to do with Ayurvedic doctors being allowed to perform surgeries. Is this always a matter that causes a lot of opinions? This is something that brings about a lot of experts to share their opinions as well. What do you have to say, and what is your point of view on this matter as such? It's almost like allopathy versus Ayurveda, if you can call it that. So, what is the crux of it, and where do you see this heading?
See, the fact of Ayurveda and surgery, if you look at it, is See, Ayurvedic surgery or Shastra Chikitsa, what we can put it as, has been like, if you look at history for that matter, say 500, 600 years back, or more than that year, so many years back, in fact, Ayurvedic doctors were the ones who started surgery, literally, because Sushruta, he has written a book. The many of the instruments which are written or described in Sushruta Samhita are used even today. Many surgeries designed by him are even used today. There is something called Sushruta flap for reconstruction of the nose. Sushruta performed brain tumor surgeries, meningioma. It's on record.
So rhinoplasty, everything was
Yes,
done many
yes,
years ago.
he did it. But what happened over time is what is more important. See, when Mughal invasion happened in India, lot of things started changing, and this Ayurvedic developments was started. At that time it started getting suppressed. Any science that stagnates for some time is dead, as good as dead. So it had to die a slow death because of that. And when British came into India, they killed it properly, because they started looking at whatever we do as inferior, and gradually that started dying. And that is why, in fact, the entire Ayurvedic system what exists today is actually not the real Ayurveda or real Ayurvedic surgery that exists, because it has been killed, literally killed. Second thing that happened is also very important. See, the modern medicine as we see it today is not what was actually considered modern medicine about, say, 150, 200 years back.
Okay.
We use the term called allopathy. Allopathy is other suffering. And when actually, if you look at the original, the asclepius, the sign what we see, that snake and this thing.
Yeah.
The snake was the one which was used for treating diseases in those days in Greece.
Okay.
They used to give snake bite for people to cure them. So it was literally a crazy medicine at that time. But what happened to that is it evolved over time. It learned new things. It borrowed things from other medicines. It means when I'm talking about science, the allopathy. So as an entity, when it traveled, it borrowed things from others. It was not restricting itself and saying, no, I will not learn. So it gained knowledge. It became better and better as it went on. And what you see today is not the allopathy of 200 years back what it was. It is completely different. It is modern medicine.
Right.
So modern medicine is actually a culmination of everything which is good, which is trying to gather, or anything it says is good. The research is done on it and it is borrowed into this system.
Okay.
So for that reason, I have a feeling that everything else, all other medicines which are there, are already a part of this modern medicine. So in my opinion, there should not be any other medicine. It has to be single kind of a treatment which is there. So Ayurveda and all these things somehow should be integrated into it. It should become one, because whatever is there has been absorbed. And another very wrong information which people have, and very often I have to encounter, is the thing that Ayurvedic medicines don't have side effects. If you see Ayurvedic thought process, they have very simple policy that anything you do, anything you have, has side effect. What they're talking about here is, if say you look at your your parents when they talk, or the older generation, every food item that they take, what do they tell? This is pitta, this is ushna.
Yeah. Correct.
Right?
Yeah.
This is tampu.
Correct.
Correct?
Yes.
So what does it mean? They're talking about the side effect of every one of those items which you are going to have.
No matter how organic it is, it does have.
Yeah, so basic Ayurvedic principle is everything that you have has side effect. So whether it is medicine or not has a side effect. That is the basic premise of Ayurveda. So for that reason, in Ayurveda, medicines don't have side effect. In Ayurveda, everything has side effect, including what you have, including water, including the day-to-day food that you have has side effect. So people miss that. People think, oh no, Ayurvedic medicines don't have side effect. No, Ayurveda says everything has side effect.
Why is there such a huge divide between allopathy and Ayurveda? Yeah.
See, at present, whatever is happening, I get a feeling it is like an affirmative action, like providing a reservation to a particular category of people. Now the fact is, the Ayurvedic surgery is as such non-existent. It has been killed by the system over the years. Was it a viable science? Yes, it was, but it is dead now. Now, do you really need to revive, and how much effort do you need to put for reviving it? That I don't think I have an answer for that, because according to me, to put an effort to revive it is of no use, according to me, because it has been killed almost totally. It's not just past. I feel it's more than 500 years since it has been really suppressed. So I don't see a value in doing it, because it will be, and it is not, you're playing around with lives. So at present, trying to do an affirmative action towards a particular thing, it doesn't really make sense to me.
But is there a need for more surgeons? Is this a fast-tracked way of doing it as such? Is that one of the reasons or motives to make this happen right now?
Yeah, but then creating more, it may be correct, but at the end of the day, if you create or you give incompetent solution or ineffective solution to a problem, it can backfire. You don't need somebody called surgeon. You want somebody who does surgeries. So calling somebody surgeon and placing them there is not going to solve your problem.
That's true. And how do you think this is going to pan out now that
Absolutely
there are so many strikes that are being called for as well, and even though we are in the midst of a pandemic, this is going to affect the medical community as well as just the society at large. What do you think would be a good resolve?
Actually, the fact is, patients are the best judge most of the times. And I have realized, so very often I think, the society will, eventually know. They'll learn to look at the degrees.
Right.
So they will look at it before, they'll ask, what are you? That is how it is going to work probably. If they see that, it's a person who's not, then the judgment will be based on the competence. In a way, see, there are a lot of places where surgeries and or quackery is going on in the entire system. In India, it's quite common. So, if you legalize some of the surgeries, which like pile surgery and all those things, which many Ayurvedic doctors are capable of doing, maybe those ones will become, they'll come in the mainstream market. Possibly, there is a scope for that. So, you see, it's an administrative decision which has to be taken at the end of the day. A lot of discussions will have to happen on that. But problems exist. It is not that simple, because, the training, the skills, the amount of number of people who are available to do it, how many, and is there a difference between technique which is being used in Ayurveda versus what is there in the modern medicine?
Yeah.
So these are the things, originally for hemorrhoids, piles, the Ayurvedic treatment was to use hair, horse hair, as well as I remember.
Right.
So to tie the piles. This kind of a technique was used before also in surgery also, modern surgery also, but nowadays we don't do that. So things have evolved.
It is so interesting and so fascinating. This has been such a educational talk for us as well. Thank you once again, Doctor. And India is always a very unique market, no matter in what perspective. The medical field as such as well, for so many number of people, the amount of doctors we have in our country, as well as India, a place that is known to and is now coming off as a medical tourism destination as well. All of these really matter, and tying these ends as well will have a diverse effect on the country at large as well. So hopefully we move in the right direction.
Hope so.
Thank you once again for spending your time on that end. As we now move around responsibly, I'd like to call it, we are unlocking as responsibly as possible. Doctors have been at the brunt. They have been the first line who have been treating so many patients over the last few months. It has been truly incredible, and I'm sure plenty of case studies have come off it. How has it been for you over the last few months? Now we see doctors are getting more busier than ever. Time is of essence, and now what's life been like compared to the last few months?
So, the front line of pandemic or the COVID care in the healthcare system, I feel, or the major brunt has been borne by the nursing staff. In my personal, because they are always at the front of it, even our cases, our surgeries and all that, the care in the ward. So I always feel the nursing staff are the most important ones who have taken the brunt here. See, but another important thing that has happened in things like cancer or treatment of cancer and all this is that there has been a lag of care. In fact, patients were scared of COVID more than cancer, and many cancers were not diagnosed in that period.
Right. A huge gap.
Huge gap. In fact, the UK, I was in a meeting in UK recently, online webinar, of course, not traveling, but and we were discussing this thing, and I was asked to present on it. And when I looked at the data, what the data says is, there is a likelihood of 20% increase in mortality due to cancer because of COVID.
Wow.
Means, because of COVID means because the patients come to healthcare later than what they had to come.
Yeah. All that of a means sudden there was a hard stop.
Yes.
Put on everything.
Yeah. So by the time a stage 1 cancer is diagnosed, if it had been diagnosed in March this year, and they had waited, or they wait for COVID to end and come in the month of, say, now November or so, by that time it would be stage 4, which means a curable cancer becomes incurable
in a matter of few months.
Yeah, few months it has become incurable, and that's when the patient has come to us. And this is something which is worrying us a lot. So that impact on the healthcare system is something, or impact on the diseases like cancer, mainly cancer. In fact, this is the only disease which is worrying the likes of NHS, for that matter. NHS is the UK healthcare system. So they are really worried about it. And in India, just imagine, we have a huge population. Our incidence of diseases is much higher. We have a lot of cancers. And there was a lull in diagnosis. Lot of tests which had to happen, the screening which had to happen did not happen in that period. Gosh. And that is a worry. That is a big, big worry. And I don't know what is the percentage of increase in the death which we are going to see due to cancer in the coming months. And I keep talking about this because it is a worrisome factor. Because we treat cancers, the results are best when the patients come in early stages.
True.
So our results worsen as the patients come late.
Yeah.
And this is something which we are genuinely worried.
I think if we get an opportunity to actually mask up and step out instead of a mall or any other place, the first place has to be a clinic and get your yearly tests done.
Yes.
Just get your routine usual tests done up and to ensure that everything is all
Screening,
right.
yes.
Yeah, the screening is done. Doctor, once again, appreciate your time. You're a busy person, even on a weekend, but we are doing this on a Saturday here. I appreciate you giving your time with us. Quickly to touch upon lifestyle of an individual. Of course, a lot of things have slowed down, but at the same time, young people are now getting affected. There are plenty of cases that we hear as well. You did talk about how life expectancy has gone up, but even to this day, when somebody walks in for a screening test, do you smoke, do you drink, having a healthy lifestyle, a healthy routine matters a whole lot. What would you like to say about sharing a few health tips on something that can be incorporated and inculcated right from within, so that the chances of us dodging cancer is more successful?
I'll just give you an example for this. If you ride a bike, as a rider, when you use helmet, you use all this protective gear, those protective gears don't guarantee you that you are absolutely safe. Your chance of getting into trouble is there, but what it tells you is you are reducing your chance of severe injury by wearing all those protective gears like helmet and all those guards. Life is exactly like that. When if you abuse your body by, say, smoking, you are drinking, you are many other factors are there. Have very bad kind of meals, like you're always on the fried thing, you are eating all the time sweets, highly processed food. So this is all abuse of your body. You don't exercise, it's an abuse of your body. So all these factors are the ones which will end you up with the chronic diseases like cancer or heart diseases, BP, diabetes, all these things. So the way to remain healthy as long as possible is, because as long as possible also I'll explain.
Right.
See, again I tell the same story. I talk about vehicle because that's the most common. So can you keep your bike healthy throughout your
mint condition? Not
no.
possible.
So what you can do is you can keep it as long as possible. So you can spoil the bike by ripping it, not maintaining it. You don't give it for servicing. You can really spoil it in a year's time. It's possible. But at the same time, a careful person can maintain it beautifully well. Make it last for 10 years, 15 years or 20 years. It'll last. So that is how your body is. You can really make a hell out of that body. You can create hell within it, and obviously it will give you trouble. But if you maintain it well, there is a very good chance that it will last you long enough. I'll take you another parallel in this. Can your bike give trouble even after maintaining it well? It can. It's possible.
Yeah.
So that same way the body also can give you trouble, because it's another question very often people ask me, I have been perfectly healthy. I've led a life so so nicely I've led my life. But suddenly, why did I get this disease? Can happen. Errors can happen in your body. What you need to look at is deliberately, am I the cause of it? Did I go and jump deliberately? Did I make or get that problem on myself? That's all we can avoid. There's nothing else you can do about it, because you are going to get older. As you get older, your risk of diseases increases.
So it's very important that one respects their body, treat it well, exercise, lead a healthy lifestyle, eat right, and be conscious about all of this, so that we at least have a good shot at life.
Exactly.
Doctor, thank you so very much once again for being part of What's Up Doc. We would love to spend more time with you and find out more about the NGO part of the work that you do as well. Multi-talented individual, and we'd love to know about all of it in the coming few days. Thank you once again.